You're watching the Wellness Hour, news that makes you healthier. Today's topic, how small improvements made to your smile can possibly change your life. According to my first guest, Beverly Hills cosmetic dentist, Dr. David Frey. Dr. Frey, welcome to the program.
Thank you, Randy. Glad to be here.
All right, now, we've had you on the program before, and for people that don't know you, I mean, here in the U.S., in the States, and I know that we are going to be broadcasting in the U.K., but you are like the go-to cosmetic dentist in Beverly Hills. So for people that don't know you, who's your typical patient that's coming in for cosmetic dentistry?
Well, a typical patient can be anyone who really doesn't enjoy smiling. Someone who smiles like this.
Their mouth closed.
Their mouth closed. They don't part their lips. They don't show teeth. Someone who's self-conscious about their teeth and wants to improve their smile. Also, people that have really bad teeth or teeth that are sort of like aging, breaking down. It's people that just want to improve their overall appearance. It's funny, Randy, but a lot of the patients come to us for like events or reasons, like their daughter's getting married or they're getting married.
You brought a lot of photos, so we're going to get to as many of those as possible. But you think the smile's pretty important. I mean, you're a dentist, of course you do, right?
Right. Well,
I mean, how important is the smile as you see it?
Well, there's so many surveys that come out year after year that tell you that a smile is of paramount importance. It's always in like the top 3. And
of what you find attractive or
what you find attractive or for success. I mean, people can look smarter, people can look better looking if their smile is enhanced. So it could really also play in the opposite way where it can make you look as if you're not that intelligent or that you're not as successful as you could be with a smile that looks appropriate and clean.
Now, we've talked in the green room, and you were saying that in Hollywood, in the movies, if you want to make somebody look poor, you give them bad teeth.
Right.
If you want to make somebody look uneducated, you remove one of their front teeth. It's very interesting. So teeth do play a role as you see it.
Oh, yeah. I mean, like you said, you're speaking to the choir. So, I mean, what we're doing is we're not just making beautiful smiles, but we're changing lives. There's so many of these patients that after we do a new smile, they come back 6 months, a year later, and I say, hey, you lost a lot of weight. And year after year, they still look like they've kept the weight off. And it's just changed their whole confidence level, their inner being, their inner smile, and they've changed their life by just changing their smile.
Now, we're talking about like porcelain veneers. Is that what we're talking about here?
Yeah, well, veneers, crowns, but yeah, made of porcelain, not using any metal at all in the front of someone's smile. And so they look natural, like the light can flow through it. I think of all the medical specialties that exist, no one can make a fake body part better than a dentist. I mean, if you brought your eye this close to the teeth, you would think they're real. It's almost impossible to tell that anything was man-made.
Now, you know, and we've talked, I feel like I could spot veneers walking down the street. Like they seem to be big and bulky.
I mean, that's impossible to happen in Beverly Hills under my direction, and I have to tell you why, because usually we make a 3D template that goes over the patient's smile prior to making the final smile. So if they were big, if they were bulky, we would tone them down and get them completely appropriate before the lab would even make the new smile.
Okay.
So that's how that works. But also, if there's also 2 types of veneers that I see in the real world. I see like a very natural look, and I see sort of a fake, more whitish look. And sometimes patients come to see me and they ask for one or the other. My job is to make people happy, and I want to give people what they want. So if someone comes in and says, I don't want anyone to know that I've ever enhanced my smile with veneers, I can do that. If they said, I want super white teeth that looks like I'm on Hollywood every day, I can make that also.
Okay, good. Now, you brought some photos, so what are we looking at here?
I brought some pictures. Here's Pam.
All right.
Pam has a very, very natural smile. She told me that they're so form-fitting that her brother-in-law was staring at her teeth and said, how did he do it? Where are they? I can't even see them. They're so natural.
It's very nice. And now you're flying, I guess, like every 2 or 3 months.
Correct.
And you're right there in London.
I'm on Harley Street, which is like the premier street to be for a Beverly Hills doctor.
Okay.
And all the best doctors and surgeons of the world are on Harley Street, and it attracts a super great clientele that go to see these doctors.
So you'll be there, what, every 3 months?
Every 3 months, yeah. So every 3 months, every quarter for 2 weeks, and my dates will be listed on my website of when I'm coming.
So a patient, and we talked a little bit about your process in the green room. So if somebody wants to see, here in the States, like one of the best of the best, and people need to know, it's a real interview. I'm trying to go out of my way not to endorse you, even though I've seen your work. It's very good, and
Thank you.
And you're well known here.
Thank you.
In the U.S. But when you go there, how are you going to do it so quickly? Because you're only going to be there for a couple of weeks at a time.
Yeah, so the teeth will be made in a week, which is no problem. But all the previous stuff, all the stuff that goes on beforehand, will be taken and done before I actually arrive. So if I need models, if I need x-rays and photographs, and we'll do Skype interviews and that kind of
So
stuff.
you'll meet the patient via Skype?
Via Skype.
You'll be able to look at their teeth and be able to give them an evaluation?
Yeah, and also make templates and make 3D models of the way the smile should look from our discussions. And so I'm ready to go and start working as soon as I arrive in London.
Okay, and then and you could do this, you say, as little as a couple of visits, 2-3 visits.
Yeah, just 2 main visits, and usually we sprinkle a couple visits around those just to make sure everything's going well and doing well. And it's rather, simple procedure.
And there's no downtime, right? So if they're there on vacationing, right? Because it's kind of a hub, right? From all over the world, people are going there.
Yeah, London is an incredible city because patients from all over the world will go to London and have work done. So there's a direct flight from any city in the world into London every day. And so that makes it ideal for me to go to London, and that's Harley Street is the place for me.
Okay, good. Now, back to your photos. You say that the teeth could really change somebody's appearance.
That's
their
right.
overall appearance.
That's right. And sometimes it's not just the teeth, but we have to also change the bite. Sometimes the bite is
the way the teeth come together?
Exactly, which we call the function. So that's why they always put those words together, form and function, art and science. So if someone's smile is really bad, why is it so bad? We get down to, look, if the bite is not right, we try to enhance the bite at the same time that we enhance the smile. So this is Fofi, and she wouldn't show any teeth when she smiled. Take a look at this before photo.
All right.
I'm telling her with my camera, smile, smile, smile big. This is as big as she can smile. And so she's not showing any teeth in her smile. So many women come to me, I want to show more teeth when I smile. All I see are my lips and I can't see any teeth. There's only one way to do that, and that's to correct the bite. By correcting the bite, we actually open up the vertical of the lips, in between the lips, and when she smiles, she could show so many more teeth. Look at her after photo. You can see how thank you. You can see how the smile just follows the contour of the lower lip, and it's now a part of her face. It's like I gave her a missing part of her face that didn't exist before. It's really a miracle.
So when it's all done and they look at the mirror for the first time, what do they say?
Well, you get different reactions when people look in the mirror. Some people jump for joy. My wife said to me, I don't understand how more and more people don't just love this procedure because it's incredible when you look at the first time in the mirror and see this unbelievable smile. Some people have a reaction, we call it smile shock, where it's almost like they don't feel like, oh my God, this is too nice. I'm gonna look, I don't know how, I'm gonna walk down the street with this gorgeous smile, it may be too nice for me. And so usually it takes a few days or so for that to actually absorb into their body, of people saying, you have the most beautiful smile I've ever seen, if they ask someone. But typically, people won't say anything because they're so natural and they just look normal. So it's only a person that's known them for a while that may actually notice. People that don't know them just think that's been their smile for their whole life. Look at the before and after again. I just want to tell you that when we enhance the bite, what we do is we find a location that's where the muscles and everything are most relaxed. And what it does is it actually makes your face so much more beautiful. Your natural beauty comes out because proportions of your face, the more you are in proportion, the more beautiful you are. It's just the way it works.
Okay.
And so she loses wrinkles around her eyes, around her face. She just smiles with more ease and just more natural looking, and she just looks more beautiful. Let me show you this next patient.
All right.
This is Erica. She has very, very small teeth. And with porcelain veneers, it's really simple. to make normal looking, natural looking teeth. Her teeth were so small that actually I wanted to open up everything to make her teeth larger. And so I did change the way her teeth come together and the bite and everything. So we did what we call a full mouth approach, a full mouth revitalization on Erica. And look at her after picture. It's just gorgeous. I mean, the way her teeth look, they're beautiful and they seem really appropriate for her face.
Like in the before, she looks a bit like a child, like a kid.
Exactly.
Now she looks like a woman.
Exactly.
You know.
I mean, I make a lot of women more beautiful. People come in and they're like average looking, and they leave like, oh my God, you're gorgeous. So it's just, sometimes it's just a small little bump of just doing your smile that, believe it or not, will change your whole look.
Now, I know, we've had this discussion that people, men and women in Beverly Hills or in London, where you're practicing, that they've got the watch and maybe the bag, and they care about what people, think about them or how they look, but they have this old smile.
Right.
Is it the fear of the dentist, you think?
I don't know. I went through the procedure myself. I sat in the chair and I thought, this is easy. I was, because some patients, it's like a bell-shaped curve. It's easier on some patients, harder on others. And so I thought it was like a wonderful thing to do for myself, and I'm so glad that I did it. But I think that you basically should have a beautiful smile, and it should go with your watch and your car. This is a want-based procedure. This is not something that anyone needs, but if you want to look younger, if you want to feel better about yourself and your appearance, then veneers and cosmetic dentistry is almost unavoidable in your lifetime.
In fact, yeah, that's one of your things, that if you want to look your best, you say, veneers are inevitable. Elaborate on that.
Yeah, I mean, it's just the natural course of aging that teeth will naturally get more yellow, brown. They wear down the more you use them. You start seeing the inner core of these teeth, this little like dark yellow line, like a tree in the bark as it goes down. And it's so simple to just put these gorgeous wafers of porcelain over your teeth and bring it back to its old, beautiful self when you were 20 years old.
Now, where you're going to be practicing in the UK, are there a lot of high-end cosmetic dentists, or are you one of the few?
No, I think it's a growing science in the UK. I think more and more dentists are trying to achieve the results, but you need to take a lot of courses to get to the level that I'm at. You need to really be entrenched in it. We buy a lot of technology. I'm always educating myself. I'm always buying the newest materials, using the best labs that understand how to make gorgeous teeth. So, I mean, you get what you pay for. You don't want a dentist who doesn't have a lot of experience doing this. You want to see pictures. You want to see before and after pictures. You want to talk to some patients that may have done it before, and do as much investigation as you can before allowing a dentist to make a smile for you.
Now, your clientele, some of the biggest names in Hollywood have been your patients, but you get regular people. I mean, just like police officers, teachers.
Right.
Is it more of those people are doing this now?
Oh yeah. I mean, basically the actors and the high-end clientele that we end up seeing is like a small percentage of our practice. 90+% of our practice is mom and the daughter, grandma. It's people that just want to look better, and it's easy to do. So the procedure is perfected. It's just so streamlined that every single aspect of it is well thought out.
So in your practice there in London, somebody meets you first online. Is that right? So I understand the process. And then with the Skype interview, you do some evaluation. Then you meet them there on Harley Street where you're going to be practicing. And within 7 days, they have their teeth.
Yeah, it's a miracle. 7 days they have their teeth. We do the same thing in Beverly Hills for our patients. And basically,
because this is like normally a 45-day
It could be long. It could be a longer period of time depending on which dentist you go to, but we have our systems so streamlined and so perfected that we can do this in 7 days.
Is that right? And just a few appointments, like 2 main appointments and then a couple of appointments for you just to look at their smile.
That's
right. Is that right?
Yeah, but I want to just make sure this is construction. It's like building a house. And so I'm talking idealistically in the real world, but it doesn't always go that way, but that's what we're trying to do on every patient. More and more men are coming in. I want to show you Donald. And Donald has what a lot of people have. They have a lot of different types of dentistry on their teeth. They may have a crown from 1980, and then they have some bonding on their teeth from 1990. And it's sort of a mosaic of different generations of dentistry. And basically we want to just clean him up.
Now he has pretty good teeth.
Yeah, he has decent teeth. His wife wanted her smile done. She came into the office, and then when he was sitting there, he's like, maybe I should get this done too. And I looked at his teeth and I said, yeah, we can improve a lot. We can, clean up and make you look a lot more successful. Okay. So take a look at the after photo.
Very nice.
And thank you. Yeah, everything's the same. Everything's unison. We modernized all the dentistry to the new millennium standards. And he looks fantastic. He's a very happy guy.
And how long will these last? And is it true they don't stain? So porcelain doesn't really stain.
Yeah, porcelain doesn't stain. I mean, they pull dishes out of the China Sea after 700 years and they show them in the museum. So, I mean, the porcelain can stay and look great. So we call it extrinsic staining that can be put on. Those are like smoking stains or coffee stains. You go to the hygienist, get your teeth cleaned, and they'll be back to new again.
Is that right?
Yeah, so internally, they will not stain.
Okay.
Yeah. Look at this patient, Randy. So she had some crooked teeth in her smile. They were just a little bit not aligned right. Her two front teeth were like this. And she did not like her smile. She told us, look at her face. Look at the way she's smiling. You could see how she's guarding a little bit. Mm-hmm. She wanted it all done. So we just basically did porcelain veneers, and look at the after result.
Very nice.
It follows the contour of the lower lip, and it's all the same color, and everything is flowing and flush, and then really simple, just 2 simple visits.
So when I see this after photo, and the teeth perfectly match her smile, are these measurements you take? Like when you're designing the smile?
Everything is very carefully calculated, measured, and everything is placed according to the way we design it.
Okay.
Exactly. So this is John. And John had a bite problem, which meant that he also had some clicks in his jaw, and he had some pain. He had headaches, jaw pain. And believe it or not, by fixing his bite, we alleviate a lot of that. And it's all about putting the bite in harmony with the muscles of the face and the teeth and the jaw joint. And everything just seems to come together. It's more of that form and function and art and science that came together with John.
So he has porcelain veneers there on the after as well?
Yeah, we put them on all his teeth, all 28 of his teeth. And it actually made him a healthier human being on top of making him more attractive.
Okay, now we should mention you went to this Las Vegas Institute. I guess what Juilliard is to music, I mean, this is where dentists from all over the world go and learn this type of dentistry. Is that right?
That's right. They have a very good way of teaching, and I've really embraced it because I'm able to implement the things I learn from there into my practice with ease, and I'm able to deliver that to the patients. So I'm able to provide excellent dental care. Nobody just invents things on their own. Everything is learned by somebody, and that's the Las Vegas Institute is a place where I...
So you've done thousands of these procedures.
I've done thousands of these procedures. Yeah, it's fair. I've done well over 20 to 25,000 porcelain restorations. I easily do over 1,000 a year. I've been a dentist for 30 years, and so basically, I know I'm very competent and skilled in doing porcelain veneers. It's always been a passion for me to do veneers. Ever since I was in dental school, I was like, why don't I learn how to do veneers? It's something you don't learn in dental school. You have to actually, it's not part of like the curriculum. You have to go outside and take courses, like at the Las Vegas Institute.
But anybody could call themselves a cosmetic dentist. Is that true?
Yeah, right. That's the scary thing, because it's not a specialty in the United States. It's like...
Is it in the UK, specialty?
I don't believe so. So it's just part of normal dentistry. So that's why anyone can say, hey, I'm a cosmetic dentist, when they actually haven't really done superior training to get themselves up to the level that we would consider skilled.
Is this more art than science? That means creating a natural smile that doesn't look fake.
It's unbelievable the thought that goes into making a natural smile. I mean, a lot of like little imperfections that would be considered looking natural are done on purpose. So I know all the tricks of the trade to make everything.
Because a lot of people fly to see you, I guess, from all over the place.
Yeah, and believe it or not, I've been treating patients from London and the UK for 20 years. They fly out on a regular basis, and so they're all happy. All my patients from the UK are extremely happy that I'm decided to go there now on a regular basis and practice my craft.
Good. Now, okay, so we have time for a few more photos.
Oh, great. Let me show you Diane.
All right.
And she's another one that, when she smiled, if you look at her before, when she smiled, the distance between her upper lip and her lower lip could barely show any teeth. And by correcting that dimension in her face, actually opened up her whole smile and her face around her eyes and face. She's way more attractive now than she was in the before picture. Look at that after.
It's very nice. It's very nice. And I think maybe looking at these, you say they're more attractive, but it does add to a person's attractiveness. People with bad teeth, and there's a lot of people with bad teeth, anticipating you were going to come on the show today, I can't help but look around and I see people. And I think people, and I know here in the US, people with bad teeth are judged or discriminated against. Like they don't have money, or they're not very clean or healthy. And you say that's just not the case. Just some people have bad teeth for a variety of reasons.
Yeah, whatever the reason is. I always like to correct the bite and the smile at the same time. I get more of a kick out of that because the whole face changes in a much more positive way when you get everything in balance. So if people have a bad teeth, you say, why? What's the origin of that? And a lot of times it stems to an imbalance.
Like chipped teeth or short teeth or whatever?
Yeah, why are you grinding? Why are they so worn down? So we get to the core of that and we find out a place where the muscles are happy, where you're not going to grind. And then we replace your teeth in that position and not in your old habitual position that caused all this damage in the first place. Let me show you Rick. He's a believe it or not, he looks really young, but he's a Silicon Valley engineer tech. And he just wanted to have a beautiful smile. As you've seen this before, he's got a crooked tooth and a weird tooth. He just wanted to have a perfect smile. And we just cleaned him up with porcelain veneer, simple smile makeover.
Very nice, very nice.
Thank you. Yeah, I want to show you Erica. This one's dramatic. I love this one.
Okay.
You have to see, like when she smiled, she had an imbalance. She wasn't smiling where her teeth looked appropriate. It just looked a little bizarre in a way. And so we had to balance her out and fix her bite also in order to make the smile come alive. Also, she didn't like that she had a gummy smile. When she smiled, she just showed a little too much gum. Showing a little bit of gum is attractive, but too much gum can be unattractive. Also, if you look at her teeth, you can see that her alignment is off. So her two front teeth, instead of being straight like this, they're kind of going like this. And that's a really simple fix with porcelain veneers.
So what did you do for her?
We created a gorgeous smile out of porcelain veneers. And
wow.
And she was getting married, so she sent us a picture of her wedding picture. Take a look at that.
It's very nice.
Yeah, and she's so pretty. When you really take a look at the transformation. Look how phenomenal she looks. I mean, she's like
she has
gorgeous.
A standout now. That's true.
Yeah, she's a standout smile. Where before she was just like an everyday average person, and now when she smiles, I mean, it's breathtaking.
We have time for a couple more. If you're just tuning in, we're talking about smile makeovers today with London's newest, hottest cosmetic dentist. He's part-time in Beverly Hills, California, and he is in London now every 3 months.
That's correct.
And a 1-week turnaround to do complete transformations like this.
That's true.
Okay, good.
That's true. Let me show you Noe.
Okay.
He doesn't, when he smiled, look at this before. When he smiles, no teeth show, all lips. Again, you have to do all the teeth, smile makeover, and we could just grab his bite a little bit, lift up his teeth, lift up all the proportions in his face, and now he's a handsome man.
Looks good. It's almost like he had no teeth before.
Yeah, it's like he was completely toothless.
Okay.
And now he has teeth. It's really remarkable. Let me show you, this is Nikki. And Nikki had a gap in her smile. take a closer look at the before. Her teeth are very flat across. I mean, she needed some body, she needed some shape on her teeth. Not only that, but we also can close all the little spaces that existed, especially in between her two front teeth. She had a large gap that she was very aware of, and it bothered her. And so take a look at the after.
Very nice.
Beautiful proportioned teeth. This is a mother-daughter, Brenda and Yvonne.
That's nice.
Yeah, and they both ended up having new teeth. That's the mom in the before picture. And again, just an everyday smile, nothing really terrible about it. But she was having dentistry done on some teeth, and she lost confidence with the dentist. And then she came, saw me in Beverly Hills, and I fixed her, and then she sent her daughter in, and I did both their teeth. That's how it works a lot. I get a lot of family members. I get the brother, the sister, the mom, the dad. And this is Mary, and Mary...
Again, that looks like a pretty good smile.
Yeah, great smile. So it's just never loved her smile. Her teeth were a little square. They were worn down. They needed shape. They needed new contours, size, and just 2 visits, and look how her smile is at the end. It's just
very nice.
Thank you very much.
Now, each one of these patients, you could do like a 7-day turnaround, but how do they know what it's going to look like beforehand? You give them, you say like this try and smile.
That's
something like that.
Yeah, so what we do is from molds that we take previously, we have a lab make a shape and a smile on your existing smile that would look like you had porcelain veneers done. It's like a 3D mock-up.
Okay.
And then we're able to convert that onto your existing teeth in between the time that you the teeth get prepared for veneers and they actually get finished. So you're actually looking at them now in between.
You get to try them in. You get to try it in.
You try them in. So if we want to make any tweaks to the smile, we do that on a separate visit. It's very simple. It usually doesn't take long. And then that way we're in good communication on color, shape, size, and everybody gets the smile that they wanted from the beginning.
We are out of time. Final message. Somebody watching this, maybe they're watching in London. They don't like their smile. They don't like their teeth. What do you say to them?
I invite them in. Come on in. Come in for a consultation. Let me see what your smile looks like. Let me help you. It's so easy for me. I've been doing this for 30 years. I can easily help you.
So you're going to be doing all your consults at the beginning via Skype?
Correct.
Or face-to-face when you go there every 3 months?
That's correct. Yeah, so, and it's really simple. Just go ahead and give us a call and we'll get you right in.
All right.
Thank
Dr.
you.
Frey, always a pleasure to have you on the show.
Thank you, Randy.
Thanks again.
Great being here.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.